Diagnosing ulcerative colitis can be tricky. After all, many digestive diseases cause similar symptoms, which you'll need to rule out.
So it is very important to get an accurate diagnosis if you're having any symptoms of ulcerative colitis, because there are adequate treatments available to improve those symptoms. The most common symptoms of ulcerative colitis include bloody diarrhea, urgency, meaning the need to immediately go to the bathroom to have a bowel movement. Rectal bleeding is common with ulcerative colitis and can be quite concerning. In patients who have disease very close to the anus, instead of diarrhea, they can present with constipation. So there's a significant overlap between Crohn's disease and ulcerative colitis. Both conditions can present with bloody diarrhea, abdominal discomfort, urgency. They can also present with constipation as a unique symptom, fever, weight loss, or cutaneous manifestations, which means symptoms on the skin that are related to Crohn's disease or ulcerative colitis.
Another digestive issue with similar symptoms is IBS.
So irritable bowel syndrome is a functional disorder of the GI system and typically manifests or presents with abdominal pain and a change in bowel habits. So that means patients can have either diarrhea or constipation. The major difference between irritable bowel syndrome and ulcerative colitis is that typically patients with ulcerative colitis have other symptoms such as rectal bleeding or weight loss or bowel movements during the evening, waking them up overnight. So there's significant overlap between the symptoms of infections of the GI system and ulcerative colitis. Common infections that we can catch from water or from food can result in symptoms of rectal bleeding, diarrhea, abdominal pain, fever. In order to make sure that there's no infection in the setting of symptoms of rectal bleeding, bloody diarrhea, or abdominal pain, a patient needs to see a doctor and have a stool test. The stool test can efficiently and effectively rule out any source of infection. Depending on the findings, the doctor will then order blood tests. These blood tests include inflammatory markers, which can pick up if there's active inflammation related to ulcerative colitis or Crohn's disease in the body. And then depending on all of these results, the doctor can order a colonoscopy to thoroughly evaluate the inside of the colon. There's also another test that can be done if needed, which is imaging, an MRI of the abdomen or a CAT scan of the abdomen that gives the full picture of what could be happening with the patient. Ulcerative colitis can have a significant negative impact on patients' quality of life, and by providing adequate diagnosis and early therapy, we can get rid of those symptoms and get patients back on the trajectory to a good quality of life.